Welcome back to our COVID-19 Congressional Town Hall. We have our 8 state representatives standing by, but first we're going to go back to Washington, D.C. and our senior senator, Roy Blunt, this evening. Senator, we appreciate you joining us on the statewide town hall broadcast today. Now, you're the chairman of the Senate Appropriations Subcommittee, more or less meaning you're in contact with the heads of all these key agencies like CDC, HHS, and NIH. What are they telling you right now that will likely have an impact on us in the future here in Missouri?
Well, John, these are the committees that people in the last couple of months have suddenly begun to hear a lot about. And I think they're working together in ways that we have always hoped they could, in terms of moving forward quickly on treatment, on testing, on a vaccine, trying to figure out how they can develop new partnerships with pharmaceutical companies and others to try to really have all of those things on a 2-track process where we're ahead of where we would have been at any other time in all of those things that we need to deal with the virus, and then eventually to emerge from the virus with a vaccine.
Yeah, I'm curious too, because you made news this week when you see the headline Shark Tank, right? So you're looking for what the newest and most revolutionary ways to get things done quickly in kind of a Shark Tank format here. Explain what you're doing.
Well, absolutely. We gave $1 billion. This is something Senator Alexander, who's the chairman of the Authorizing Committee, I'm the chairman of the Appropriating Committee. We've worked together for 2 months now to try to come up with a unique way to fast forward the decision-making process. And in 5 days after the bill was signed, the National Institute of Health had a Shark Tank up and running. They had 400 responses in the very first day. Now the job is for those Shark Tank experts to narrow those responses down. What we want to do is say, let's get the 4 things that have at least a 50% chance of being successful, and let's go ahead and start toward production with all 4 of them. So by the time they've gone through the final test, let's say it's a vaccine, 1 of those or 2 of those, or however many got through the final test, would already be ready to go out and be available rather than be 30 days away or 60 days away from Missourians and people all over the country being able to get that vaccine. So we're trying to buy time here with a concept that's a little different than what the federal government's ever done before, but I think it's going to work.
Is that what it's going to take to get back to normal? Either, well, first a treatment and then a vaccine, because it's kind of hard to see everything getting back to the way it was until we have both those things in place.
The 3 things we need to be focused on are the vaccine, which probably takes the longest, but we're trying hard to get that done. If we can at all, set a record and get that done by the end of this year. Therapeutics, treatment, which also looking for the things that work short of the vaccine to get you through the virus better when you get it. And then the other thing I think that's going to be critically important is an easy to take and a quick response on testing. And so vaccine, therapeutics, testing, all are part of the Shark Tank concept. They're talking about a warp speed view toward a vaccine. That's exactly what we're talking about as part of the whole Shark Tank process.
Senator, one last question here for you. We keep hearing the calls to make sure that from this point on, the manufacture of drugs, of vaccines, of PPE is done in America, along with pharmaceuticals, of course. How do we ensure that that actually happens this time? Because we've been debating this for years, and now we find out how urgent that actually is.
Well, in the CARES bill, in that big bill, not the one we just did to clean the big bill up and do things that needed to be to fill in the gaps in the CARES bill, Senator Durbin and I actually proposed an idea. We worked together on some things. There are a lot of things we don't agree on, but one was to have a crash study by the National Science Foundation of our supply chain for PPE, the protective equipment, a supply chain for medical devices, a supply chain for pharmaceuticals. I think we're going to be looking at lots of supply chains as we get out of this and the economy generally, but the most critical one to look at is the one that impacts healthcare. That's already started, it's already funded. We hope to have some answers soon on what we need to do to have a supply chain that's more secure for America's health, and also to be sure that we have a supply chain where we don't just have a sole source for anything that we need to keep our country safe and healthy.
Senator Roy Blunt, we appreciate your time today.
Great to be with you, John.
We turn our attention now to Kansas City. Also, the southeastern portion of the state and our northern district. But we begin. Congressman Emmanuel Cleaver represents the 5th District, which is the city of Kansas City, and it stretches to the east. He's also the former mayor of Kansas City, so he knows that district well. Now, Congressman, Kansas City has had a relatively small number of cases compared to St. Louis. Tell us what's happening in your district, and is there a concern you could see this spike in cases?
Well, we could, but there are some differences, and they are major, particularly as it relates to this pandemic. First, St. Louis is a much older city, and the congestion in the urban core is much, much tighter than it is in Kansas City. We are a city of 322 square miles. St. Louis is not even half that size, so they are congested. The other reason is that, and this is not a good thing, I wish I could say something differently, but the virus is hitting disproportionately Black and brown individuals. And it's for one of the reasons is the congestion. And St. Louis has a larger Black population than Kansas City. We have a larger Latino population in Kansas City than they have in St. Louis. But I think also St. Louis has a lot more traffic coming in and out. The suburbs are much larger, and they have many more chances for this disease to move around. We are fortunate in Kansas City that we have not had an explosion, and that's why I'm still pushing for folk to respond positively to the instructions we've been given in terms of social distancing and also sheltering in place. It's tough, but we've got to do it. We can keep these numbers down if we work together and don't give in to the virus.
You know, Congressman, a couple of things here. Two-pronged question here. One, what is your administration doing to help out leaders in Kansas City if you see an uptick? And secondly, you know, if we start to see these numbers go up again, having to shelter in place again for the second time, I can't imagine how that turns out. How would you put that back in place effectively?
Well, sheltering in place is extremely important. But we've been told by the scientists that if we go too soon, if we move too rapidly, that the second surge could be far more deadly than the first. So we've got to work to make sure that doesn't happen, that there's no second surge. The other thing is that we have appropriated dollars. For example, right now, in the money that was given to Jackson County, they have money for testing. They have money also for the indigent care hospitals. And I think working with the 8 cities, I think, or so in Jackson County, they will be able to provide cities with some of the help that they'll need locally. This is something that everybody in the state's got to work together, because I don't think any one city or one region of the state of Missouri can do this separately and independently.
Yeah, okay. One more here. Viewer question. Alan Lee Summit writes, I miss sports. Don't we all? When do you see sports returning? Now, you guys have the Super Bowl champion Chiefs over there. It's a state known for sports teams and sports fans. On the eastern side, people want to see the Cardinals. So what does that look like? How do we get back to that point, or do we even see that this year?
Well, don't forget the fact that this is the home of the Kansas City Chiefs. You did the right thing by mentioning that.
I had to.
But look, South Korea has already resumed its baseball season. And they did so because they've had massive testing. Now, they did begin without fans, so we may have to think about that. Look, I don't want to miss the baseball season, nor can I even remotely give any consideration to missing the football season. But it's going to be a different kind of a season, I think, in baseball and in football. And it's something we're just going to have to live with. I think we can still have a great team. We can be great fans. But there's no point in us saying things are not going to change, because they're going to change. What we have to do is reduce the drama when those changes occur.
Okay. Congressman Emmanuel Cleaver in Kansas City, appreciate your time today, and we will talk to you soon. Let's head towards southeast Missouri in the Boot Heel. That is District 8, and that is where we find Representative Jason Smith. All right, Congressman Smith, what are your biggest concerns in your district right now, encompassing the Boot Heel and a big swath of southeast Missouri?
You know, John, what I'm hearing from people across southern Missouri is that they just want to get back to work. What everyone wants is to have life normal again. Our country was founded on the ideas of personal choice and liberty. The government cannot and should not manage the risk for the individual. We have to do that for ourselves. Everyone has to decide what is best for themselves. The government should not tell us how to live. All of us are united as Americans by our love of the U.S. Constitution and the Bill of Rights. These are the rules by which all of us live by. They were in place long before any of us, and they'll be around long after any of us. We have to adhere to that and not infringe on anyone's rights. The folks here in South Missouri, like myself and President Trump, know that Americans make their own decisions and don't need the heavy hand of the government to control their lives.
Okay, viewer question right here. Jason from Cape Girardeau writes, healthcare workers are risking their lives in the battle against COVID-19. How do we get them hazard pay? What would that look like anyway, Jason, when you talk about hazard pay? Because we have a lot of people who are putting their lives on the line every day for this.
You know, our healthcare workers are risking a lot. They are warriors. They're the heroes fighting on the front lines. And I want to thank each and every one of them across this state for their tireless work during these difficult times. Back in mid-March, at the beginning of this outbreak, I held a call with all of our healthcare providers, our doctors and first responders, to hear about what resources they need. I've continued to stay in touch with them and offer my assistance. I would tell this gentleman from Cape Girardeau that the way that we go about getting them hazard pay is by having Speaker Pelosi allow the U.S. House of Representatives to meet and allow members to discuss proposals to help their communities, their districts. Unfortunately, Speaker Pelosi is trying to block out our members so she can unilaterally negotiate the next coronavirus response legislation. The needs of rural Missouri are not the same as those desires of San Francisco.
Very quickly, speaking of those diverse needs, I've been speaking with Dr. Ed LaValle, who's an infectious disease physician there in Cape, and he points out that Cape has seen a lot of cases. Outlying areas like Oregon, Howell, some of the other counties in the Boot Heel are pretty much unscathed. Those areas can be overlooked with funding because they're not getting a lot of attention. So what do you do to make sure those areas, even though they're being hurt by not working, that they still get the funding they need to get back to normal?
You have to be the squeaky wheel. We've made it a priority from day one, whenever this pandemic started, of being in contact with our small businesses, our healthcare professionals, our farmers, our veterans, and hearing their individual concerns and relaying those individual concerns back to House and Senate leadership and also President Trump. And a lot of great things have been accomplished from those conference calls that we've been able to get progress from the administration. One is telehealth. It is great that the administration, after our pressing, eliminated the requirement that you have to have visual conduct. You can have audio, but also to have visual to do telehealth was ridiculous in an area like in Southeast Missouri, where we don't even have broadband in some areas. How can you do visual? You don't have cell phone service. So hopefully now with the administration making it where they can just do it by a phone call and seniors can talk to their doctors, get their prescription drugs, that was promising. So when you're looking at 30 counties, you have to look at all different ways in order to fulfill those needs of the folks in Southeast.
All right, once again, Congressman Jason Smith, Southeast Missouri, appreciate your time today. Also joining us today is Congressman Sam Graves. He is from the 6th District, and he's got a unique district. It stretches all the way from Illinois, all the way over to Kansas, Nebraska, up along the border with Iowa. It's a huge area, a lot of diverse needs. Look at the district right there. Now, Congressman, in your district, by the way, is also St. Joseph. There's a meat packing plant there that at last check had 400 confirmed cases of COVID-19, although nearly all of the positive cases didn't show symptoms. Okay, what do you understand why people are concerned in that area. What are you hearing from people in that area?
So it is a real problem. And the problem with packing facilities or meat processing facilities is they're just not conducive to social distancing. I mean, they're literally shoulder to shoulder working those processing lines. So what's happening is, and I know that the facilities out there, the meat processing facilities, are taking a look at this on how they can spread people out. They're trying to figure out, just how effective, if providing the PPE, whether it's masks, they all wear gloves anyway, and so things like that, if it is going to be effective. The bigger problem is if we were to shut down those plants, then the entire food processing or distribution chain starts to break down and it backs everything up. And then all of a sudden we have problems with the producers out there and nothing to do with that livestock and that meat. And the fact of the matter is the country has to be fed. So we're rapidly working through this process right now, trying to figure out just exactly what can be done and how quickly we can do it. Retooling these plants is something that is being looked at, but that's going to take a lot of time and a lot of effort just to be able to spread people out that 6 feet. So it's a big problem, and it's something that we're trying to address.
Yeah, your district stretches the entire top part of Missouri, mostly rural areas. So, kind of like in the southeast portion of the state, you have different needs than maybe they have in St. Louis or Kansas City. What sort of needs are there up there in an area that's pretty much been unscathed right so far that we may not realize?
So one of the things we've learned in the whole process of staying at home is when people are trying to run their business or doing things like this over the internet, is we are very lacking when it comes to high-speed internet. And it's something that that we've talked about for a long time, deploying broadband and getting that high-speed internet to everyone out there. But we have learned that whether it's going to school or taking classes or it's telemedicine, as Jason pointed out, or it's just running your business. Without high-speed internet, it makes it very, very hard to get through the day. If your signal is dropped or you can't get through or whatever the case may be. So that's something that we've identified as not only a priority, but it's an extreme priority and something that that we need to take a hard look at and make sure that it's done quicker rather than later.
Yeah, one thing that's come up time and again in the show this evening is we've started to relax social distancing for a lot of people. If we have to go back now and say, okay, we have to do it again because we have an uptick in cases, I don't know how that happens. Do you foresee something like that happening, especially in a district like yours that hasn't seen many cases? How do you tell your people who've started doing business again that you have to go back to your houses?
Well, and that's a hard thing to do, particularly when we're in, for instance, planting season right now. For the most part, all of your rural areas, business has to go on and that crop has to get in the ground. And we're seeing, just that exact thing. And the virus isn't going away. Regardless of whether we get the country back or the economy back online or how soon that is going to be, the virus isn't going away. And I think the new norm is obviously going to be social distancing, staying 6 foot away from an individual, wearing a mask if you're close to that, washing your hands regularly, often. I think that is the new norm. And that's what we're going to have to practice. Eventually, we're going to have to open the economy back up and get the country moving again. And that's, we're just.
Okay, and he is having some internet troubles right now, I do believe. And we're not going to get him back. Okay, so let's see if we can pull up Representative Cleaver once again, see if he is still around so we can talk to him a little bit more about what's going on in Kansas City. If we can pull him back up. Okay, Congressman, one more for you here. Okay, sure. As we start to go back to whatever the new normal is or the lack thereof, right? What are you encouraging your constituents to keep in mind so that we don't go back too soon to the way it was and put us at more risk?
Well, look, it's going to require that all of us do things that we've never done before. And as Sam Graves just mentioned, we have a new normal. I mean, I wear gloves whenever I'm outside of my home. I have a mask right here on my desk. And I think we're going to have to realize that when we're doing this, we're not protecting ourselves so much, we're protecting others. And then we're also protecting our families because we don't want to take it back home. But at the same time, everybody's got to think when they go out, I'm going to protect others, and hopefully there are people out there who want to protect me. We can get beyond this. We can win this battle. There's going to eventually be, probably won't be as soon as people are declaring, we're going to have some kind of a vaccine. We don't have a vaccine for HIV. Most people think that it's been controlled and stopped because we came up with a vaccine. We have not, but we found out how to treat it and reduce, almost eliminate the deaths. That may happen here, but we can't give in. We can't give out. We've got to understand that even if it's dark right now, that there's light on the other side, and that's the only way to make it is with the hope that we can endure this and come out better on the other side. as a nation and as individuals.
Okay, and we're going to go back now to Congressman Graves one more time here. We want to get him in one last chance because he's also on the Transportation Committee, a ranking member there, and also a pilot. So Lexi from Kirksville asked this question. When do you think we can start getting on a plane and going on vacation again? Lexi asked the question. It's what everybody in Missouri is thinking right now. What are you hearing?
That's a great question. The good news is, at least right now, the airlines are now all requiring masks to be worn if you're going to fly to protect the flying public. I think that we're going to start seeing more and more people fly. And there's a lot of myths out there that people don't realize too. A lot of folks think that when you get in to an airliner that air is circulated within and is spreading all kinds of germs. That's just simply not the case. That air is exhausted outside the aircraft and new air comes in. So things like that, we don't have to worry so much about. And I'm going to, there's a lot of people that are flying right now, not nearly as many as there were before. But again, we have to get the country back up and going, but we also have to, to remember that we are protecting other people. So, it's whether it's wearing gloves or wearing that mask, staying 6 foot apart, spreading out, whatever the case may be. That's what we're going to have to do and wash our hands. So that's the new norm, and we're going to have to do that.
Well, we hope it gets back to that very quickly. Congressman Sam Graves, do appreciate it. And that concludes our conversations with Missouri's congressional delegation this evening. Again, we want to thank all 8 members of the House and our 2 senators for joining us today on this conversation. So the question now is, where do we go from here in Missouri and across the country? Nearly every medical expert we've spoken with says that Missouri is on the path to recovery, but there will be some bumps along the way. But it's good to know that the solution to this pandemic will probably have some Missouri roots. We know that the initial phase of testing with remdesivir was done at St. Louis University, which is on the forefront of medical research. We know that Pfizer in St. Louis has also been picked to manufacture the potential vaccine. You also have the infectious disease doctors in Kansas City, at Mizzou's medical school, and the great hospitals across the state who are saving lives with groundbreaking treatments. We've heard the stories of nurses who have put the lives of others ahead of their own, even camping outside their own homes so to be close to their families, but not too close to infect them. Yes, it's been tough for everyone. Missourians aren't meant to be separated, we are meant to be together, and that time is coming soon. As we near our state's 200th birthday in 2021, this will be a part of our history that none of us will ever forget. But we aren't out of the woods quite yet. We will get through this, but it will take time, patience, and a lot of hard work. But we have faced tough times before, and we will overcome once again. So once again, I want to thank all the lawmakers who took time out of their busy schedules to give us some insight into what's happening in their areas that's going to impact all of our lives. It is rare to have the entire congressional delegation in one place at one time, so we are truly thankful for their time. And I want to thank you for joining us across the state of Missouri for this COVID-19 Congressional Town Hall. I'm John Brown. Good night.